thing. Case in point, the previous Lubbock City Council had the intestinal fortitude and also the character to actually put the city health plan out for bid. Amazingly enough, Blue Cross got selected, so city employees could go anywhere they wanted. And you know, you ought to go look at the tape from that city council meeting when that all came down. I was there. It was mind-boggling. It was mind-boggling. Some of the things that went on and some of the things that, you know, when you have one city councilman said that speaks to two executives at a local health system by name, calls them by name, and said that he had spoken to both of them, and they said if the city went with Blue Cross, they were pulling out of Blue Cross. And fortunately, that session ended with the city council doing the right thing and voting to go with Blue Cross, who's inclusive with all local providers. But I think it boils down to standing up and doing the right thing. How do you get the word out? Good question. You ever seen anything on any of the local TV stations or in the AJ bad-mouthing any of any local health systems?
No, but that's why, again...
But you see their advertisements.
Absolutely. You kind of wonder, follow the money. But the whole idea of these series that Dr. Scioli and I decided we wanted to do this was, this is our attempt, although I do find it interesting that after the first two that we've done, I sent out news releases that I faxed to all the local media. I sent out emails to all the lists that I had, and I get nothing from the media back about saying, oh, well, this is interesting. I'm not hearing anything from Karen McKay saying on Channel 11, oh, my gosh, there's an interesting YouTube video that people should go see. Why is that? We can speculate. But the grassroots effort, I mean, I think the idea is to go back to what Dr. Carr is saying, which is nobody really wants a government, but have we grown kind of, have some this inertia about we don't know what else to do in our leadership? Is it maybe doing... But we don't have transparency? Is that a good word, Dr. Scioli?
Well, there's certainly no transparency. I mean, that's an obvious fact in my book. And I'm talking about transparency all across the board. The transparency of political negotiation is totally absent. The transparency of medical billing is totally absent. And it's impossible to allow the market forces to work properly when it's, you know, hide the salami. It's just not right. And for those of us that know a little bit about what's going on, all you can do is just pull what little hair you got left out. And again, whatever you want to say about Nancy Pelosi, nothing in her 2,000-plus page bill fixes anything we've talked about tonight. Nothing.
Well, she doesn't know anything about health care.
Of course she doesn't.
None of them do, and they don't consult anybody that does. You know, a bunch of legislators that they don't have a clue. And I will say this for Bill Clinton. When he was trying to do something, he had his wife working on it. At least she had been on the board of Arkansas Children's Hospital when I lived there and worked at Baptist Health System there. She was on the board of Arkansas Children's Hospital, so at least she had a semblance of experience with this. But I would love to see the resumes of all these brilliant people that Obama has working on it. It would be, they don't have a clue.
Well, and one thing that concerns me is, as a psychologist, I live in a world of words. I live in concepts. That's a big part of what I do. And so when people, they talk in the abstract about how we're going to save this money, and then you say, well, how? And they're not sure. Or when they say that, well, we're going to limit care for a certain group of people. Well, that sounds good, except for then if you're working in the ER at 3 o'clock in the morning and somebody comes in and they happen to be in that group that you're supposed to limit the care, then the problem is, what are you supposed to do other than say, well, you're really not supposed to get care, and then they don't think through the natural conclusion of that, which, see, again, it's a good idea maybe to say we want to study and let science guide science, and maybe an ankle fusion is better than an artificial joint. But then there's not the latitude of saying, but doctor, you're the one on the case, what do we do? And see, that's when we talk about local politics, local is where I can understand it. I get lost in how much is a trillion, but I understand if after Dad gets off work, he goes home and then he goes and volunteers at a clinic and he sees 15 more people, I can understand that. But see, I think that's what gets lost in this, is that we don't have the local response other than people, decrying what's coming out of Washington. In the meanwhile, there's this hide the potato thing that happens with, well, how did the city council, or how did the city used to get their insurance before? And how is it that these people seem to know each other in this back room kind of way? And they hit it. But again, I'm hopeful that in our discussion here, we can start to kind of say, wake up, wake up. I don't know if we're all Paul Revere riding around.
What would be the starting group or starting organization or starting person that could begin to put something together?
Well, it's an interesting concept.
It wouldn't be the medical society.
No, you would think that they should be,
Right.
but the medical society in Lubbock has lost some of the vision of what because they won't take a political stand on something, and that's an issue. Ted, what you're asking is reasonable. It would have to become an advocate that would at least be given a forum. And in this town, that wouldn't get you very far, because you got huge political good old boy systems that have to be climbed over and then stomped down before you get any result in change. And when it's as ingrained from the chamber to the hospital systems to the insurance carriers in the area, one guy screaming with a flag in the street will really be one guy screaming with a flag in the street. Nothing much happens after he's finished.
But there has to be a solution.
You would think that there would be, and the ultimate reality is that common sense doesn't affect people until they have a crisis.
That's true.
They don't feel the other's pain because we're all so busy. We're all running around. And it is unfortunate, but that's reality. That's life. And it's not just the guys doing the right thing. If the chamber had any integrity, they would say, and why can't people go to any healthcare facility with this plan? Somebody is getting to them and saying, these people stay over at Covenant and UMC. Why? Because Covenant and UMC want that revenue. And they would do that at the expense of quality in reality, because you look at their statistics, you look at their infection rates, you look at their numbers for given case care, and you compare them to Heart Hospital. You compare them to North Star. They can't justify their position. But the position doesn't change.
We're down to about the last 2 minutes or so, but one point that I have, I'd like to throw out there and get comments from you all is, in any national debate, there are strong opinions and strong words. Part of my concern is that, as a person who spends my day trying to figure out who's crazy, that it occurs to me that the language that we see sometimes inflames us. And I make this point because on the eve of the assassination of John F. Kennedy, that I ran across a full-page ad in the Dallas Morning News that came out on Thursday, November 22nd, 1963, that reads, "Hello, Mr. Kennedy," and it proceeds to label him a communist, a socialist, a horrible person, that something must be done. Full-page ad in the Dallas Morning News. Not a flyer, not some left-wing group just yelling on the corner, but serious money spent to take out this ad. And it makes me wonder, the difficulty we have now is that when you see the internet and the ability we have to communicate, that, some would